Today, we're going to talk about what's in the news with all things Social Security and Medicare. If you're new to my channel, my name is Ed Weir. I ran the third business Social Security office in the country. And in my semi-retirement, I'm helping you all get everything you're entitled to from all things Social Security, Medicare, retirement, survivor benefits, all the rest of it. This is also a live Q&A, so make sure you type your questions. I already got a bunch of questions there. I'll get into the news of the day, go through it all, give you all my opinions and perspectives on it. And as we used to say in the Marine Corps, my opinion and $15 will get you a cup of coffee at Starbucks, but I'm going to talk to you about it anyway. And you can mute my opinions if you want, but be that as it may, I'm going to give them to you. All right, so let's talk about the breaking news going out there today. So we got four things I want to talk about, and there was another I want to add on there. Just came out today. The Social Security Fairness Act. It's kind of a misnomer, if you ask me. Social Security cuts, what we're looking at in the future. Customer service delays. I've done a video on that. I'll kind of recap that. Social Security Online, and then also the Commissioner of Social Security was on News Nation today and said a bad word online. So it's interesting. So he's out as the commissioner. He's resigned. So I guess he can say whatever he wants now. So there's that. All right. So the first story we have is Schumer says the Senate will vote on the Social Security changes, and Social Security changes were what they're talking about. This legislation, this bill passed the House of Representatives with pretty much bipartisan support. It's the one that's going to get rid of the windfall elimination provision and the government pension offset. So about 3% of the American working public works for state or local entities. Federal employees pay Social Security FICA tax ever since the early 1980s. But there are some state and local employees out there that do not play with Social Security in their main jobs. So they're teachers, firefighters, police, whatever the case may be. And those systems decided to opt out of the Social Security Administration. But a lot of those employees worked at other places before and they paid into Social Security, or if they're a cop, they did some security work on the side and paid into Social Security. And when they get their Social Security benefits, it's recalculated. If you ever hear anybody say it's reduced, that is, yeah, they're trying to lead you down the wrong way. It's recalculated because the Social Security computer system is kind of old, antiquated, and it doesn't calculate it the way it should. It can now, but for decades it couldn't. And these individuals were receiving more. They were receiving a benefit amount that was intended for low income wage earners. And in order to stop that extra benefit that was going to these 3%, that is where they came in with this thing called the windfall elimination provision, the provision to eliminate the windfall. What is the windfall? The extra benefit that was being paid. And a lot of people out there are probably blowing smoke right now on fire. I'm not getting an extra benefit. My benefit is this, that, or the other. So let me go in this one more time. People just don't understand. Politicians, I think politicians understand it, but they're trying to get votes or whatever the case may be. Social Security determines your benefit amount by your high 35 years of earnings. They take your high 35 years of earnings, they average it. It's called the averaged index monthly earnings. They take your earnings and index it for basically like an inflation. So if you made $20,000 in 1975, it's not worth $20,000 today. It's probably worth $100,000 today. So they take all that and they come up with your average index monthly earnings. And then they multiply it by these bin points down there, 90% for the first part, 32%, 15%. Why do they have these progressive bin points? Because see the chart here, if on the far right, it says $10,000. So if your average income throughout your life was $10,000, you're going to get a 35% replacement rate. That means you're getting 35% of that back when you retire. So about $3,400. If you're at the other end of the spectrum, if you're low income wage earner throughout your life and your average index monthly earning was only $1,000, Congress decided that, well, you're not going to have a 401k. If you're only making $1,000 throughout your life, you're not going to have a 401k or savings. You've probably been on welfare all your life. You've been really, really just having a hard time. So we're going to give you some more as a percentage. So you're going to get 90%. right? And then it's progressive. So if someone's making $5,000 average throughout their life, they get about a 46% replacement rate. What happens is because these teachers and firefighters and cops didn't pay into the system, they paid into another system. It looks as for the majority of it, it looks like they're low income wage earners, so they're going to get a 90% replacement rate. Even though, let's say, a cop that was working in Topeka, Kansas, making about $5,000, they paid into Social Security, they get a 46% replacement rate. A cop that works in Florida, let's say, that didn't pay into it, their average throughout their life was $5,000, but they only paid the $1,000 into Social Security. So they're getting a 90% replacement rate. So why should these people get a 90% replacement rate when someone equal to them is only receiving a 46% replacement rate? If it passes the Senate, and that's exactly what's going to happen. Those people are going to get an extra benefit that wasn't intended for them. So I hope that doesn't pass. I hope the president doesn't sign it, but it looks like it's going to happen, and it's going to affect everybody because it's going to put about another $190 billion of debt of costs into the Social Security Trust Fund, and therefore the Social Security Trust Fund will run out sooner, and we'll have cuts sooner and all the rest of it. So hopefully it doesn't pass. Is there sh- should there be other solutions? Yes, the Social Security computer system now they can calculate your pension. Those 3% of people, they are able to calculate it. Before 1983, those people's non-entity pension, those non-covered pensions, did not report to Social Security. So, a couple of decades ago, Social Security computer system couldn't calculate it. Now they pretty much can. So there's other solutions because, yeah, sometimes the windfall elimination provision kind of hurts the people that have been low income wage earners, but it's really going to benefit a whole bunch of other people, and they're going to get twice the amount of check than they should have, or other people that worked in the same amount are going to get. So it's the the Social Security Fairness Act. If it passes, I say the other 97% of us go for another law that says Social Security Fairness Act 97%, but this is the Fairness Act for 3%. But anyway, so I'm going to get a lot of comments about that, but again, people just don't understand it. All right, Social Security cuts. Um, so the president, I talked about this a little while ago. The president-elect Trump said they're not going to raise the retirement age, and they're not going to do cuts. They're just going to get whatever. They're going to get what they're going to get, and that's good. I like that. But as I've talked about in other videos, the issue is sure. In this administration, we're not going to get cuts. Well, we're already getting cuts. I'll talk about that in a second. But the cuts are not slated to come immediately here. Let me throw up the this is when the cuts are going to happen. So we've known about these cuts for decades, that in about 2034 we're going to get 21% cuts because there's less money coming into Social Security, and at that time the trust fund that we saved up to cover these gaps is empty. So we're still going to get Social Security. Social Security is still going to be around here for another 50, 75, 100 years. It's just that we're going to get less, 21% cuts across the board if we don't do anything. In 2031, we're going to get 33% cuts if the next administration does some of the things they're talking about, cutting taxes and different things, because that's going to affect Social Security negatively. We're all good for cutting taxes, but it's going to have a negative effect on our benefits going forward. If we do the right thing, if we fix it, then there's 0% cuts. But it seems as though the solution out there is again, some politicians, the president-elect said he's not going to cut it, and then this other Missouri congressman commented that everything is on the table. We've got Doge out there with Elon Musk, and there's a secret behind the doors. Kind of negotiations are looking for $2 trillion. If they're going to cut $2 trillion, I guarantee it's got to be coming from Social Security and Medicare and Medicaid, because that makes up quite a bit of the national budget, even though Social Security and Medicare do not add one penny to the deficit, because Social Security and Medicare are self-funded. They are a separate entity. Sure, the general revenue has borrowed from that money, but that is still just like bank. You have to pay back the bank, and the Social Security right now is a bank that the general fund is borrowing from. Um, so they got to get their story straight. Are they going to cut benefits? Are they going to raise the retirement age? And it's interesting that it just so happened today that the commissioner of Social Security, the soon to be outgoing commissioner of Social Security, let me get rid of this here, went on News Nation this morning, and the reporter was saying, okay, hey, the long range results, the trust fund is going to disappear in 2031 or 2034, and there's only a certain amount of solutions. And this is this is a terrible reporter. I don't know who this guy is, but he's a terrible reporter. This is the only solutions out there is to raise taxes by 3.3%, reduce it, cut benefits by 21%, or 25% for everybody, or a combination of the above. No, if you look at I put a link to the Social Security actuaries report in the description, and you can see there's dozens and dozens and dozens and dozens of different, ideas to save Social Security, and those, it seems like it's the government didn't plan, the politicians didn't plan, they're not doing the right thing to support Social Security. So I guess, now that it's crunch time, the only thing we do is raise taxes on everybody or cut your benefits. No, that's kind of I would argue that's been the plan all along. But the solution I advocate for those regular viewers out there is, right now there's a cap, and the cap is if you and me and 99% of the people watching this, you pay Social Security on every dollar you make. If you make under $176,100 for next year. After that, if you make over 176,000, you don't pay Social Security FICA tax anymore. Go figure. So we've been paying FICA tax on all our money for the last several decades. Why don't we share the wealth and have the other, the people that are making over $176,100 pay Social Security FICA taxes on all their income for a few decades? Because right now, if you're making $5 million, you're only paying 0.44% of that income. If you're making 10 million, then you're paying a lot less into FICA. But us schmoes, we're paying 6.2%, and our employer paying 6.2%. And so, yeah, there are and you can go click on the link, the actuary report, and it gives you all of the different proposals to save Social Security and how much it would save it and all the rest of it. So you can look for it yourself. It'll take you 10 minutes to solve the problems of Social Security. It's just that we need politicians to act and do something now. All right. And now this is what we've got in terms of current cuts. So, Social Security beneficiaries at risk of delays amid funding fight. Okay, so these are cuts happening right now, and this is exactly why I'm doing this channel, is because now Social Security has essentially turned into a five-star restaurant. You got to have reservations to talk to them, even though you paid FICA taxes all those decades, and part of that FICA tax was supposed to go to help to get you help when you need it, but they can't help because they're at a 50-year low in terms of staffing. They're not getting support by politicians. And so these are the delays that are going to happen. You're going to have a harder time to get your retirement benefits, disability benefits, spouse benefits, survivor benefits. It's going to take you longer. I talked about this a couple of days ago. Call your congressperson. I've got a petition there as well. If you look in the chat, there is a petition to get the politicians to support Social Security. Social Security just needs 1.2% of outlays in order to, do everything they need to do. And what is happening, these politicians are playing games. They're trying to, distract, and they're saying, well, we gave you all $100 million extra last year. And come on, how much more do you want? Well, the fixed costs, rent goes up, electricity for all these, thousands of buildings, the COLA increase for employees, because, they have families too. That was over, I think the commissioner said it was about $400 or $500. So an extra $100 million, sure, thank you. But now that means we're an extra 3 or 400 million dollars under what we need this year to survive. So they've got layoffs coming. I remember when I ran my office, we had a couple of times where we had kind of furloughs, and particularly in terms of disability. Um, and so they play these politicians say, "Hey, we gave you an extra $100 million, so until you all improve customer service or whatever." But again, you need employees. They're at a 50-year low in terms of staffing. And another thing they say, well, you're teleworking. I talked about this several times in my office, in every office in the country. People telework, they're just as efficient as they are at their desks. We assign them appointments, 6, 7, 8 appointments a day. And whether they're sitting next to the person and they have to take those appointments, or if they're sitting 10 miles down the road in their house, those appointments have to be taken. Those claims have to be adjudicated. Those phones have to be answered. It doesn't matter whether the person is in the same office or down the street. It doesn't matter. If you all want people to go back to the office, then unfortunately, I think I know a lot of Social Security employees. Some of them got used to teleworking, and they if they're kind of forced to go back to the office, I think you're going to lose more staffing. So it's probably going to, be a 60-year low. So yeah, telework, whether it's good or bad, it's not deteriorating customer service at all. So again, it's just politicians use an excuse to distract you because they don't want to fund Social Security, because they ultimately want to give Social Security over to their Wall Street buddies and drown it in the bathtub. So, okay. And the final thing I'm going to talk about today, then I'll open it up to all your questions, is Social Security Online. Make sure you go into your Social Security account, mysocialsecurity.gov, SSA.gov. Go in there and update your Social Security account. If you haven't, if you've started it a few years ago, you went in there and never used it, you have to make sure you go in there, because Social Security, to be efficient, which I think was a great idea, they're going to stop sending out mail. I used to process the mail in my office, and we spent a lot of money on postage. So they've gotten smart, and they said, hey, kind of letters, COLA increase letters, and all these type of letters that we usually mail out and spend a lot of money and postage and envelopes and all that kind of stuff. We're just going to send that to your My Social Security account. So if you get some type of information, you just go in, you log into SSA.gov, your My Social Security account, and you'll see it there rather than getting a letter in the mail. So I think you can opt out of the paper or the electronic if you really, really want to. But that's a good thing. But you have to go in there and make sure you update your Social Security account and go through the new process. The more the robust system, the more secure system. So, all right, let's go ahead and so that's the news for today. And I'll keep an eye on all the rest of the stuff, keep you all up to date, and that way you all get everything you earned for all those decades you paid into it. All right, let's see. Let's go down to questions for about 40 minutes or so. My son is divorced and his ex works for a school district for many, many years. Will he be able to draw benefits from her since he is legally blind? Thank you. Um, for divorced spouse benefits, as long as he was married to that person for 10 years or longer, um, and legally blind doesn't necessarily matter. We're talking about regular spouse benefits. So he can start receiving benefits on her record at 62 years old. If he was married to her for 10 years or longer, and then her benefit amount was twice his benefit amount. In order to get spouse benefits, divorce spouse benefits, or anything, your benefits have to be less than half of the spouse's. And yes, if those criteria apply, you are good. If I am 6'3", 6'3" you probably mean 63. Anyway, and I start Social Security due to cashed out vacation or sick time count against the monthly limit on income earned. No, you can just, it's basically when you file for benefits, the first month you file, or excuse me, the first year you file for benefits, Social Security can switch to a monthly earnings limit. So for 2025, it's $23,400. But let's say you start collecting your benefits in July of next year. Up until June, the first 6 months, Social Security doesn't care. So you can make $1 billion a month, doesn't matter. But starting July, when you want to start your benefits, you have to be under the monthly limit, and the monthly limit is $1,950. 23,400 divided by 12. So the monthly limit. So the first month you're under the monthly limit, starting in July, then you can go ahead and get benefits for the rest of the year. You have to stay under that monthly limit for the rest of the year. If then the following year, then you can't do the monthly thing again. You can only do the monthly thing one time. And any type of cashed out sick time or vacation time that you get in July, it wasn't earned in July, it was earned prior to that. So you just tell them, hey, in July, I'm from work, I'm only going to make 1860, or excuse me, 1950. 1860 is this year, but 1950, I'm only going to make under 1950. And then you just say, but I'm going to get a leftover check because, whatever. And that's not an issue. However, I will caution you, if the computer picks it up when you file your taxes the following year, sometimes the computer kind of doesn't understand, or the person that takes your claim doesn't put it in there correctly. There's supposed to be a place where they put the NSM, non-service months, where sometimes they don't do it correctly. Everybody in my office did because we trained them. But anyway, but if you get a letter saying, "Hey, we overpaid you," you just have to take your proofs down there and say, "Yeah, that $2, $3, $4, $5,000 was from a previous period," and they'll correct it. So no problem whatsoever. All right. My question for you: if my husband and I are already on Social Security, can I change and collect off of his? You can collect. You can't change. You still get your benefits. You have to continue to get your benefits. But if his benefit is twice as much as yours, yeah, absolutely. Call and see if there's any more benefits. Don't look at your checks, because your check is what we call the MBA, the monthly benefit amount. You want to look at the PIA, the primary insurance amount, which is the amount at your full retirement age. So what Social Security determines to look to see if one is higher than the other, they look at the PIA, the primary insurance amount. They look at yours and they look at his. And if one is higher than the other, then yes, you can get the higher the amount. One offsets the other. But yeah, you can't necessarily stop yours. You continue to get yours, plus extra benefits is added on there. So I have two questions. First, my husband works for NYPD. Is it true that because he will collect a pension, his Social Security benefits will be reduced by half? No, it won't be reduced. If you're One of the problems with these 3% of people that work for these NYPD and stuff is they look at their statement that they get every year and they say, oh, according to my Social Security statement, it says I'm going to get $2,000. So anything less than $2,000, they're saying, oh, I'm being ripped off, I'm being reduced. No, it specifically says on there, and all the Social Security statements that you ever received, it says this is correct unless you are receiving a non-covered pension. Right now, there's a whole page that explains it. So people just are not reading. They just look at the $2,000 and like, oh, $2,000. Oh, wait, I'm only getting $1,000. Oh, I'm being ripped off. But again, he might not get the extra welfare income, low income related extra bump that was intended for low income wage earners. He will get his correct amount, but he won't get any extra above and beyond what everybody else it gets that played with Social Security the entire time. Again, so some of those, the calculations on the WEP, particularly for people, teachers or people that worked in, kind of the lunchroom or something at a school. The windfall elimination provision is bad in terms of the low income earners. It definitely needs to be corrected, and it can be corrected because the computer system now can actually do that. But throwing the entire thing out, completely just throwing away windfall elimination provision is definitely not fair for the other 97% of us. So, let's see. I'm the person who asked about prior work under civil service and Social Security. I was on the phone with OPM for an hour today and gave up. Yes, the OPM is, I know exactly, the Office of Personnel Management, people that work to federal employees, that's who they get their pension from. Most government workers are low wage earners. They should get the same benefit as everyone else if they qualify. I agree. 100%. But throwing away WEP will mean they get more than other people that everybody else gets. So it's completely unfair. even though the act is a fairness act. Yeah, it's unfair. So, what stimulus check? Yeah, again, there's so much clickbait out there. So, good afternoon, Dr. Ed. It does my heart good to see you. Oh, awesome. Good. Being on SSDI myself, I wish my wife would say that sometime. Anyway, being on SSDI myself, age 60, at what age does my wife, 56, become eligible to file for her benefits on my record? 62 years old. Yep. So if her benefit amount is less than half of yours, then she can start receiving benefits on your record at 62 years old. She has to file for benefits on her own record, but unfortunately, yeah. Let's see. I watch your video on what happens after your SSDI. I can't find the MIE on my decision awards letter. I'll be 60 years old soon. My award letter did say review 5 to 7 years. Yeah, so that's a medical improvement. Expected. Those are for CDRs, the continuing disability review. When you're on disability, they review your case every 18 months or 3 years or 5 years or 7 years, and to see if you're still disabled and everything. So, Zippy, here's my recommendation: forget about it. Don't stress it, because even if you're on a 5 year cycle and your 5 year cycle is coming up, it depends on the budget, because Congress allocates money separately for CDRs and RZs, which are redeterminations for SSI. So each office gets a quota and says, my office used to get them all the time, every quarter, and says, okay, Ed, in your office, you have to do 100 CDRs every month, and you can't do 99, and you better not do a 101. It has to be exactly 100. So it's a numbers game, and everybody has to send out a whole bunch of CDR packages, and people get it and they fill it out and they waste all their time and they're stressing it, and nothing ever happens because the quota has already been met of 100. It's a stupid system, and it stresses people out. So here's my philosophy: FCF. Forget about it, complete it when you get it, and then forget about it again. Please don't stress yourself out. If you're on disability and you've got enough stressors in your life, you don't need to worry about CDR. So when you get it in the mail, you get it in the mail, or you get an email and it's in your My Social Security, then it's there. Then worry about it. But don't worry about it until then. So I'm 63, not receiving benefits. I currently make about $5,400 a month salary. Is it possible to file for benefits and then exercise my one-time change by canceling in 4 months and go back? Yes. But if you're making 5,400 and you tell them you're making 5,400, and then they're going to stop your benefits anyway, because you're going to be making over. If again, they go to the annual. If you make 5,400 in 1 month and none for the rest of the year, then you're not going over the 23,000. But if you say, hey, I'm going to make $60,000, then you're not going to get a check anyway for however many months. But if they do start your benefits, what you're talking about is the 12-month withdrawal. So within 12 months of filing for retirement, you can withdraw your application like it never happened. And because it never happened, guess what? You have to pay back all that money. So yes, you can do that. Yes. Call your senators Monday to stop Social Security Fairness Act. I did 2 weeks ago because of Ed's knowledge. No more time for inaction. Yes, please tell them. And again, I apologize for the 3% out there. I know there's 0.5% of those 3% that it's kind of going to hurt. And the windfall elimination provision, the way it's structured now, the way it's calculated, sure, it does hurt, unfortunately, a small percentage, but it's going to give a lot more money to people that it wasn't intended to. So we do need to fix the way it's calculated, but throwing the baby out with the bathwater is not the solution. So there's other proposals out there to correct the calculations. I started watching my Social Security from my first job back in 1970, all of the updates and everything. Retired in 2016. Yes, you have to watch it and understand it. Yes, good. Wow, someone that. And one of the things, please, everybody, all the young people out there in your life, we're coming up on our favorite season, tax season. And okay, I've been trying to cancel my subscription with the IRS for decades, and it hasn't happened yet. But anyway, once you file your taxes, tell everybody in your family, all your family and young kids and relatives and everybody, when you file your taxes, pay all your taxes, yada yada yada. That's not the last step. You have one more step after that. A few weeks after you file your taxes, sometimes it takes a little longer. the IRS, when you file your taxes, the IRS notifies Social Security how much you paid into FICA for your Social Security and Medicare. Check it. Go into my Social Security, SSA.gov, set up an account, check your earnings, make sure it's all good. Takes you 2 seconds, and say, "Oh, okay, it got reflected in there perfectly, all good. All right, go on with your life." Because what happens is people don't check that, and then when they go to retire, 20, 30, 40 years later, they say, wow, my earnings from 1982 aren't in there, and I don't have the proof, and I guess I really should have checked at that time and got it corrected, but I didn't, and therefore you're going to lose benefits for the rest of your life. And then your spouse is going to lose benefits, and your surviving spouse, and yeah, it just makes everything wrong. So it's important to go in there and check every single year. So you can actually do it every 2 years, I guess, 3 years, but please make sure everybody goes in there and yeah, check it. Not all teachers. I paid FICA in Virginia. Yes, only about 3% of, yeah, again, it's only, city, state, local workers, county workers and stuff. There's a very small percentage. People always say, well, Congress needs to pay into FICA. They do. Since the 1980s, under Reagan and Tip O'Neill, the famous beer they had, they kind of did a whole bunch of things to fix Social Security for the long term, but they kind of missed a couple of things, and that's why we're having an issue now. And the thing that they missed is they didn't realize how our regular people's wages would rather stagnate, and the people that make money making crap loads of money. I guess Elon is what, 400 billion or so, and he pays nothing pretty much into FICA. I'm sure he pays nothing into FICA because he doesn't get regular wages. So there's that. I am on original Medicare and was paying IRMA. I got married last year and filed the SSA 44. Finally got approved, so the IRMA got reduced. They back adjusted the amounts. Will I get a refund check? Yes, you should get that money back. So awesome. Yes, this is IRMA season. I'm going to do a video on IRMA because it's IRMA season. What is IRMA? Income related monthly adjustment amount. It's basically based on earnings from 2 years ago. There is a logical reason why it's 2 years ago. If you're a high wage earner, for this year it's 103,000 or 206,000 if you're married, then you pay an extra Part B premium. Everybody pays $185, but if you're a high wage earner, you pay more, hundreds of dollars more. But there are cases where you can appeal that with an SSA 44, and a life-changing event, and they can reduce that. And if they determine that, oh yeah, you shouldn't have paid the IRMA, then you'll get refunded. So yeah, and then if you're getting that, that's why I reached out to a chapter there, and they can help you with all other things Medicare related. So they're going to get a raise plus still get their pension. That's crazy. How does the Senate not see that? I think it's just politics. That's you've got all these government workers that have been complaining about this for decades, and they have gotten organized really, really well. And they frame it as, we're getting, you're not supporting firefighters and cops and stuff like that. It's like, yeah, we're not giving you extra like the other 97% of firefighters and cops. So if these 3%, some of them are going to get twice percentage, instead of getting what, 46% of a replacement rate like they should, like someone equal, the other 97%, they're going to get a 90%. So they're getting twice as much as the other 97% cops and firefighters and, all the rest of it. So yeah, they just, yeah, the power of good packaging, I guess, right? Um, okay, I already answered that one. Let's see. You are really not looking at the big picture. It would run out sooner if it wasn't for the money and donations that we blindly gave to Social Security, and this fund has used interest free. Not sure what that means. Interest free. No, Social Security does get money when they loan it to the general fund, into treasury bills, and treasury bills, just like 401ks that you have are in treasury bills, treasury bonds. They get an interest, and Social Security gets an interest too. Yeah, so, and the $2.7 trillion is still there. It's not been stolen. That's another distraction that politicians use to, kind of, they. I Let me pop up This is the plan to destroy Social Security. They ignore the problems, they ignore all the solutions, they distract by saying the trust was fund, the trust fund was stolen. We're giving it to illegals, fraud, waste, and abuse is everything. Sure, there is fraud, waste, abuse. The internet myth of the day. The internet myth of the day is we're giving it to Ukraine, and what's the ultimate goal is to privatize, give it to Wall Street. Make Social Security Advantage kind of like a Medicare Advantage or disadvantage. So yeah, these are all the tricks that they're using to try to destroy Social Security. And they're doing a pretty good job. They're succeeding. They're kind of eroding public trust in Social Security and having us go down all these rabbit holes. And so um, let's see here. Called chapter to discuss about my Medicare plan and learned I am in the right plan, though it's a little expensive. TQ and a gentleman in the chapter. Awesome. Yeah. So yeah, sounds like you're in the right plan. Maybe a little bit expensive. Sounds like probably a Medicare supplement plan. But if you're in a Medicare supplement plan, I always recommend. Some people eventually the Medicare supplement, the G or the N, it gets a little bit too expensive. But please try to stay in it as long as you possibly can. Always go for Medicare supplements or G and N. But if it doesn't work for you, then look for Medicare Advantage plans. And I wish there was a better system, but there's not. But yeah, Chapter is doing a phenomenal job and giving you all your options. So they helped a lot of people out during this last annual enrollment period, and a lot of the people that called them, Chapter said, "Yep, you're in the good plan. Yep, in your particular area, yours is the best plan. So just keep on keeping on. Bye. Have a great holiday." So they don't do the hard sell and stuff. So I really appreciate that. Social Security means nothing to Musk and the other 11 billionaires in Trump's incoming administration. Crumbs to them. Yeah, it's interesting that those people are going to decide what's going to happen to our $1,900 a month check. The average of Social Security check is 1,900, and it's nothing to anyway. Remove the dang cap and extremely yeah. That's again they say well it's not fair. Well, is it fair that we've been paying FICA tax on all the money we've earned for the past 40 or 50 years and they haven't? Okay. We'll switch it up for the next 40 or 50 years and everybody can pay the equal amount of FICA. And then after that, we'll figure out the more fair system. But let's make it fair over the next 40 years. All I hear is how the fund will run out. However, Social Security has used our contribution for years interest-free. Incorrect. It's run out. It's not our fault. They don't have a problem doing COLA increases. Well, yeah, people need COLA increases. Yeah. But the problem, the fund running out is when it was originally started in the 1980s, the reason it was started was to address the baby boomers. And they looked at it, they calculated how much they think they would need. And there's two things that their crystal ball, as all future crystal balls are not perfect. They didn't realize the demographic shift in terms of less children in the future. We were going to have less children. And the number one thing is they didn't realize how much money would go outside of being taxed in FICA. In 1980s, 90% of income paid into FICA. Right now, today, it's 81%. And that 9% gap is the reason the trust fund will run out. So we just need to fill that gap. How do we do that? We end the cap. So super, super easy. That'll solve 73% of the problem. That we just need to tweak a little bit more here and there. And that's another thing politicians say, well, removing the cap and having the rich pay you, it's not going to solve everything. It's not going to, 100% solution. It's not going to give Ed his hair back. And so if it's not a perfect solution, then we forget about it. No, that's again, another distraction. And we need to be smarter and stop falling for it. All right. Do you have a suggestion for what we can say to our senators rep on how to prevent future cuts to Social Security? Yes. Smash the cap. Yes. Smash the cap. Easiest, the cap. Everybody pay into FICA like the other, 90+% of us. So Ohio teachers. Yes. Ohio as well. Yes. Ohio is one of those non-covered pensions. Spouse and I always filed jointly. In 2022, we sold our vacation home, and in 2024, we each have had to pay $174 and extra $33 Part D each for IRMA. Should we have to pay IRMA for one home sold? An extra 30 for Part D. Well, Yeah, it sounds like if you have a Part D, you have to pay for that. If that's all you're paying, then you don't have an IRMA charge. It sounds like because everybody paid $174.70, and if you have a Part D that costs $33, then you have to pay. But if you're paying above and beyond that because of a home sold, then yes, unfortunately, when Congress made that IRMA law, they didn't put a carve out for capital gains based on a home sale. Yeah, so a lot of people get stuck, but it's only an increase for 1 year. They should have really done that because, once you get older, a lot of people downsize their home, and so they sell it and they make that money. And unfortunately, if they're on Medicare, then they get it increased because they're considered a high income earner because of that capital gains of selling a home. The Congress should really, I mean, talk about a fairness act. That should be the Social Security or the Medicare Fairness Act. That's one we should push for. Is okay if you're just if it's if you're a millionaire and you've sold a bunch of stock that made capital gains, then okay, all right, sure. But if you're just you've had your home and you're the home you raised your kids in, and you decide to downgrade, and that causes extra Part B premium, I think that should be fixed. So, if we're going to do a fairness act, I think that should be, number one on the fairness act. But anyway, 62 years, divorced woman, not enough working credits, 29 years marriage on SSI disabled since 2020. Ex-spouse EU collecting SSA benefits for past 6 years. At which age can I get 50% of amount collected by X? Okay, right now, because you're on SSI, which is the income related, or the low income means tested welfare based programs, supplemental security income that Social Security administers, you probably already received a letter that you're 62 years old, so you have to file for benefits on your own record to get the retirement benefits, because SSI comes out of the general revenue, general funds, general taxation, because it's a welfare based program. It doesn't come out of Social Security, the Social Security Trust Fund or Disability Trust Fund. It's a separate trust. Not a trust fund, just general taxation. So because it's general taxation, Social Security is supposed to, you know, you're supposed to file for any benefits you're entitled to. So at 62, if you worked and you're insured for Social Security, then you have to file for benefits on your own record. And let's say your retirement benefits on your own record is like $500. Right now, you're receiving the max SSI, $943. So what will happen is they'll make you sign up for retirement benefits on your own record, get that $500, and then the other $443 will come out of SSI. So you'll get it, it's for you. You don't care because you're getting the same amount of money. But if you also have entitled to a spouse benefits or divorce spouse benefits, you'll have to file for that too. So let's say you get $500 from your own, and you get another $200 from that person, so it's a $700. So you'll get your $700 plus another $243 from SSI. So you'll be getting three different things, and it'll come in one check and everything. So, yeah. But in terms of your question, when will you get exactly 50%? Once you hit your full retirement age. But you're not going to be able to, because you have to file for benefits at 62 because you're receiving SSI. So if they find out that you didn't file for everything you're entitled to, then if they find out that you're entitled to $1,200 in the future or something, then they're going to have an issue, because they're saying, hey, you should have filed for that benefit. So, and then hey, if you get $1,200, so no soup for you. The government has been incompetent with their management of our Social Security. Apparently, this fund should have been projecting future needs long ago. This is completely incompetent. Yeah, no, it's just we're talking about the 1980s here, and they didn't see how much wage stagnation would be so terrible, and they didn't realize how much the rich would get so incredibly rich, and good for them, but they don't pay FICA taxes, and that's the issue. So they just didn't see those two things. They didn't realize it. So, and you know, yeah. So hindsight is 2020, but it's not 2020, and looking in the future is not 2020 as well. They just need to raise the cap. Yep. Yes. Um, yeah, there's one. The current president, Joe Biden, has a proposal, but it's unfortunately it's not going anywhere because it gets politics. The other party controls the House, and his idea is to raise the cap, but put like a donut hole in there. So like from 176,100 to 400,000, you don't pay. After 400,000, they do pay. I think that's, it's more of a political type way to make it, more palatable to pass or whatever the case may be. But anyway, all right, let's see. I was victim of a government imposter scam, lost a lot of dollars. Now Social Security wants to raise my Medicare premiums because they see retirement distribution on a tax return. I didn't get money. Scammers did. How do I appeal? So SSA 40. Well, on that one right there, that's not really a life-changing event. That is, I don't think Social Security can do anything about that, because they just go by line 11 and line 2A of your tax return. So whatever the IRS tells them is what Social Security goes by. So if you didn't, you need to correct your taxes. You need specifically to correct line 11 and line 2A of your tax return, and you have to do that through the IRS. Do the amended taxes, whatever the case may be, and then submit that to Social Security, and then they'll correct it. Oh yeah, the other petition, I'm putting together another petition about. So I've got the petition to improve customer service at your local Social Security office, and then I'm putting together another petition to smash the cap. So my son is legally blind, not working due to two strokes. Can he draw from? Okay, I already answered that one. Um, I'm sure your congressman is sitting by their phone waiting for your call. I think they have what's it the was it the bat line directly to their main supporters. Yeah, I hate to be cynical there, Boaster, but I think I'm right with you. But we can try, right? It is possible. You study American history. It is possible to get, if there's enough mass movement out there, it is possible to get change. But we just need to get together and stop the distractions and stop, the word games. I get all the time. It's not an entitlement. I paid for it. Well, do a Google search, pull out your dictionary and look for the word entitlement. There's a 4-letter definition of entitlement. But there's also the legal and insurance, interpretation, a definition of entitlement and stuff. So we get distracted. It's being stolen, it's being given to illegals, and my brother's sister's cousin, twice removed, had a friend that got Social Security disability, and he shouldn't have got it. So therefore, we're gonna, yeah. So we need to stop all the distractions. So I hope I'm gone by then. Well, I can't make it now on $1,005, so I don't know how I could possibly handle any type of cut. Yeah. It's going to hurt the people that it's going to hurt. It's the worst. The people that don't need the money, they're talking about giving the rest of y'all cuts, and that's not right at all. But make sure you watch the video, LJ. I did a video a couple of weeks ago on living on Social Security alone. If you're only receiving 1,005, and if you've got no other income, hopefully you're receiving Medicaid. Contact, to save, because if you're paying $185 for Medicare Part B, then hopefully, Medicaid will pick that up for you and they'll pay the $185. So definitely reach out to Department of Social Services, Department of Medicaid, Welfare, whatever it is called in your particular state, and ask them to pay for your Part B premium. And if they do, they'll pay for your Part B premium and they'll cover a lot of your healthcare costs. And if that is one time I recommend a Medicare Advantage plan, because you can't really get a Medicare supplement plan if you're on Medicaid. You get a Medicare Advantage dual eligible plan. So if you get the higher levels of Medicaid, there's several different levels depending on your state. If you get the higher levels of Medicaid and you have Medicare, you're dual eligible, and you can get one of those Medicare Advantage dual eligible plans. And those are the ones you see with the scammy, grocery cards and over the counter cards. They're not scams. Those cards do exist, but the way they advertise them is really really scammy. They take the best one in the country that's only available in one area, and they advertise it to everybody to get you to call. So they shouldn't be doing that. That's a bait and switch. But if you want to find out what's available in your area, you can reach out to Chapter, and you tell them your zip code, and they can tell you exactly what's available in your area, and they'll check to see what level of Medicaid you're on, and hopefully get you some more money. So speaking of, I called Chapter with Tony. She was great. Told me about HMO. Since I'm healthy, no meds. This plan will pay $102 of the 185 Plan B. How are they able to do this? Not complain cures. Yes. Okay. Yes, that is Medicare Advantage Part B give back. And okay, so a Part B give back is a type of Medicare Advantage. There's different, you got Medicare Advantage, the dual eligible one, and it's called a C-SNP, a chronic one. But there's also a version called the Part B give back, where the company pays for part of your Part B. A lot of those are popular with vets, and that's why they're called honor plans or patriot plans. So how are they able to do it? Well, when you sign up for a Medicare Advantage plan, you're number one, you're essentially giving up original Medicare. So you're saying, Medicare, I'm not going to appeal to Medicare. I'm going to get all my health care from this company. And so that company, when you sign up for them, they take their cup and they go to Washington, D.C., and they just said, hey, I just signed up Brenda. Give me X amount of money every month and I'll take care of her health care. So in your particular case, you chose that one. And part of the money they get is they pay for part of your Part B, and that's how they, got you to, enticed you to sign up for that particular plan, is because they gave you, $102. But you remember on those, if you're healthy and everything, you're young and healthy, 65, 70, healthy, then those are great. If you have, VA, that's why they're great for veterans, is because the VA, a lot of the vets use, the VA medical facilities, and they don't really need anything out there. And they're like, but I have to get Part B, or I want to get Part B, but I don't want to pay for it. So they get those to pay for it. But as long as you're smart about it, those are great. Because these health insurance companies, they don't get to be $1 billion health insurance companies for being stupid. If they're going to give you $102, then they're going to be taking out of other places. So the same company has two plans: one that gives you $102, and the other one that doesn't. Same company, just different plans, different versions of plans they have. Because the company is giving you $102 here, the other stuff might be a little bit more expensive. Like if you go to a night in a hospital, it might be $200. The one that doesn't give you $102, maybe it's $100 a month. So, the life insurance companies, the health insurance companies, they run their numbers. But get that $102. That's get you an extra $1,000 in your pocket next year, and then the following year, if you're still healthy and everything, you know, roll it again, do it again. Find one that's better money. But if you start, feeling a little sick, or you might have some type of operation or something like that, it might be good to switch to a regular plan that has more coverage. But yeah, as long as you're good, then awesome. Got you extra $1,000, $1,200. Take you a nice little trip to Hawaii and say thank you to Chapter or whatever companies give you that money. So there's that. Um, I wish Mr. Trump would take you in his Social Security Administration team. I've reached out. I have reached out to all the powers that be, and I said, "Hey, I'm willing. I know where all the I know where Social Security can save money. It's not going to make a big difference in the trust fund, but the big thing is to prevent the the cuts in the future and the current cuts happening now. And what do you talk about current cuts happening now? When politicians refuse to fund Social Security, the help you need to get your Social Security benefits, that's essentially a cut, because you're not able to get the right amount at the right time and get the help you need to navigate the 20,000 pages of policy. And so there are a lot of people out there not receiving benefits they're entitled to, they earned, because they're not able to access the system. They don't know what to do. They don't get any help. And so there's that. Um, I'm starting to panic a little bit because I have not heard anything from the insurance company I was set up with, Chapter broker. How long does it take normally? I know I didn't call till last week. Oh, okay. You called at the very last minute. So, yeah. Yep. No problem. Yeah. It's what happens is when you enroll in whatever plan you chose, chapter sends that, or any company, they send that to Medicare, CMS, the Center for Medicare Medicaid Services, which they check everything and they notify your old plan if you have an old plan, and then they notify the new one, and then yeah, it takes you'll probably get something in the next week or so, but if not, yeah, reach out to chapter and just double check. But yep, you're good. You've plenty of time there, and it doesn't take effect until January 1st if you're talking about the December 7th, the new plan. So your current plan is still in effect until December 7th, and your new plan will start January 1st. So government HR won't work with my Social Security account. They set up accounts and wait time on phone is over an hour. Yeah. Again, that's it's another barrier for you to get your Social Security benefits. And I'm going to do a video next few days about why certain people want Social Security to be destroyed. There's several reasons why people don't want Social Security to be here, and I'll talk about that in the next few days. Ed, I am past FRA for retirement age, however, continue to work full time from home and in good health. Have signed up for Medicare Part A only, could work until 70. Could you speak with you so that you could review? Yeah, I've got, again, I've 99.9% of the help provide here. I help with all things Social Security, retirement, disability, Medicare Part A, Part B type stuff. That's 100% free on this one. I do have private calls that I do charge for in order to pay for the phones and computer systems and stuff. Medicare, a chapter Medicare helps with Medicare supplements, Medicare Advantage, Part D plans, 100% free. So 99.9% of the help we provide here is free, but there is, yeah, one that, got to pay the rent. So yeah, so you can schedule an appointment there. But in terms of just looking at your question now, yeah, if you continue to work and you have health insurance from work, then you do not have to sign up for Part B. If you sign up for money, if you start your money benefits, you do have to sign up for Part A after if you're 65 or older. But Part B, you can refuse because you have health insurance from your work, or your current work, your work, or your spouse's work, and your employer has 20 or more employees. If that's the case, then you do not have to sign up for Part B. So if you work until you're 70, 80, 90 years old, and at that time, if you stop work and stop receiving health insurance, then you have to go ahead and sign up for Part B, and then find yourself something to keep, to cover all the gaps, original A and B. So always check out Medicare supplements first, Plan N or Plan G. Compare those two, see which one you like. If that's not for you, then check out Medicare Advantage, but always check out Medicare supplements first. Anytime you're new to Medicare at 65 or new to Part B or whatever, and you're looking for a Medicare plan, I don't care who you talk to, your cousin or neighbor that does Medicare insurance, as a broker, agent, or whatever the case may be, always say, okay, talk to me about it. Start with Plan N and G, Medicare supplements, because unfortunately, a lot of people out there just start with Medicare Advantage, and yeah, you don't want to do that if you can avoid it. If you can't avoid it, then you just have to do it right. So I was just approved for SSDI. November was the 6 month after the 5 month waiting period. Yes, nobody gets paid for the first 5 months they're on Social Security disability. I was paid 12/24. Do I get another check in for December on my regular pay period, or I get it paid in January? Yeah, I did. Yeah, if you were already paid in December, um, then yeah, that was the November check. So the November check. So you were born the third, the third 10 days of the month, because you're getting paid the third. So you were born between, excuse me, the 11th and the 20th of whatever you were born, because you're getting your check on the third Wednesday of the month. Yes. All right. So if you were born if your date of birth is the first 10 days, you get paid on the second Wednesday of the month. If second 10 days of the month, you get paid on the third Wednesday of the month. Okay. Am I saying that correctly? Anyway, but yeah, so you'll get your next check in January. Yep. The December check comes in January. They always pay a month late like that. So SEA began SSI at 62. SSI is the welfare-based program. You're probably talking about regular Social Security. Given Part A, but not Part B. Oh, okay. So you're SSDI, sounds like. Okay. Now, 9 years later, told a 10% penalty for every year's no Part B. Check my Social Security account and no mention of penalty. Unsure of Medicare, low income. Yeah, if you were eligible for Medicare because you were on disability for 2 years, 24 months, then at that time you had to sign up for Part A and Part B. Part A was automatic, but it sounds like possibly you refused Part B because you had health insurance from work, yours or your spouse's. If you did, then you just need to provide and prove that. The reason I didn't sign up at that time is because I had health insurance from current work, mine or my spouse's. And then they'll address that. But if you need help with that, yeah, reach out to chapter there, and they can check to see if there's a penalty and walk you through the process. My benefit at 65 will be $3,500. I'm 61 now. What survivor benefits would my wife get if I died before I retired? It depends on how old she is, and whether you started collecting benefits early or not. So if you didn't start benefits, or if you waited till your full retirement age or whatever, and she and you she starts her benefit at her full retirement age. If she starts survivor benefits at her full retirement age, then she will receive what, $3,800. Because if you say you're going to get 3,565, that's reduced because 65 is not your full retirement age. Yours is probably what, 66 and 8 months, or 67. So your full benefit amount is probably about 3,800. So she'll get 100% of your full benefit amount if that event happens after she is her full. If she starts her benefits after her full retirement age. So I already got my Plan D drug card. I changed companies the last week of open enrollment. Oh, okay. Wow. So yeah, Part D is pretty easy. So yeah, those are a little bit quicker. And it's also the company. It depends what company. Some companies are a little bit slower than others. And so, yeah. But yeah, just keep an eye on that. Make sure you get it. We've got, a couple, 3 weeks until the first. So all right, we are over an hour, and unfortunately, yeah, still got a lot of questions. I'm thinking about because I've got a lot of supporters that they become members, and it's only a few dollars to become a member. So I guess maybe I'll do a member only Q&A. So if, I'll probably do one of those in the next couple of weeks or so. So if you're interested, become a member, support, buy me a coffee or whatever. I'd appreciate it. Y'all have an awesome night. Make sure you share, subscribe, like, so this information can get out to more people. I really do appreciate it. Y'all take care. Have a beautiful day.